Hello everyone. Today I am going to make a short video about the ophthalmology instrument. At first, wire speculum. The wire speculum is also called a universal because it is used in both eye. The uses of wire speculum are it is used to keep lead apart in different surgery. For example, the intraocular surgery such as cataract, glaucoma, keratoplasty, extraocular surgery such as the squint and pterygium, and also in the enucleation and evisceration operation. It is also used in the removal of the conjunctival and corneal foreign body. It is also used in the examination of the eye in case of the blepharospasm, and it is also used in the cauterization of the corneal suture. What are the disadvantages? The disadvantage is it doesn't have the screw. There is limited capacity in hematoma. This is the universal wire speculum. It is used to keep a lead apart. Then in next, let's discuss about some of the forces. First one is the plane forces. Plane forces mean it does not have the teeth, so it is called the plane forces. Uh, we can see in the picture, the teeth are absent in the plane forces. Then discuss the uses. Main use of plane forces, it is used to hold the conjunctiva during any surgical procedure, and it is also used to tie a suture, and it is also used to hold the scleral flap during trabeculotomy and hold the skin during eyelid surgery. The picture shows in the slide. This is the plane forceps, and this one is also the plane forceps. Now discuss about the corneoscleral forceps. Corneoscleral forceps. There are two types of corneoscleral forceps. One is the colibri forceps, and another one is the limb forceps. Colibri forceps. We can remember that C means the copton. So this one is the copton. So this is the colibri forceps. Let's discuss the uses. The only use of colibri forceps is it is used colibri and limb forceps both. As its name implies, the corneoscleral forceps. It is used to hold the cornea and scleral edges for suturing during different surgeries such as the cataract, glaucoma, and for the repair of the corneal and scleral tears, and for the keratoplasty operation. Here we can have some view on these two forceps. This one is the limb forceps, and the sharp U-turning one is the colibri forceps. Here also we can see this is the limb forceps and this is the colibri forceps, and this one is the plane forceps. And now let's discuss on the epilation forceps. As you know, epilation means to remove the cilia. Epilation forceps consists of the two end. One is the flat end, and one is the flat end, and one is the blunt end. This one is the epilation forceps, which is shown in the picture. And epilation forceps is mainly used to epilate the cilia, such as in trichosis and styl. And it is also used to remove the cilia after the electrolysis and cryolysis surgery. And it is also used to remove the cilia which gets lodged into the punctum. If the cilia is lodged into the punctum, we also have to remove the cilia. And then the artery forceps. Artery forceps is also known as the artery hemostatic forceps. If the artery forceps is small, if the artery forceps is small size, then it is also known as the mosquito artery forceps. The parts of the artery forceps are it contain of the blunt tip with a scissor-like configuration. This is the scissor-like configuration, and it contains of the multiple straight groups near the tip. Near the tip, it contains the multiple straight group, and it lacking the mechanism near the range end. In the near range end, this one is the picture of the artery hemostasis forceps, and we can see the instrument pictures. What are the uses of artery hemostasis forceps? Mainly, it is used to catch the bleeding vessels during the lid and lacrimal sac surgery. In the lacrimal sac surgery and lid surgery, we can catch the bleeding vessels, and also it is used to hold the cuspids, and it is also used to hold the skin and muscles straight suture. Then next one is the Kelman-McPherson forceps. Kelman-McPherson forceps. Again, how can I identify the Kelman-McPherson forceps? We should look about the tip. The tip is slightly curved in the upper end, and from the slightly curved end, we can identify the Kelman-McPherson forceps. So, what are the uses? Uses is it is mainly used to hold the superior haptic of intraocular lens during placement, and it is also used to tear of the entrocapsule during extracapsular cataract extraction for entrocapsular axis, and also it is used for the suture tying. So, this one is the Kelman-McPherson forceps. Don't look on the whole, just look on the blunt tip. The blunt tip indicate the Kelman-McPherson forceps. Here is also this one, and then the intraocular lens. First, here we have to remember that intraocular lens consists of the two part. One is the central optic, and second one is the haptic. Haptic is superior and inferior haptic. First, the intraocular lens consists of the superior and inferior. It is of a different type, anterior chamber intraocular lens. In the sulcus or intermediate part, or in the posterior chamber intraocular lens, there is posterior and anterior chamber intraocular lens. Posterior chamber is kept in the between the in the sulcus or in the posterior capsule. Best one is the posterior chamber intraocular lens. Here, anterior chamber is made of uh, PMMA, polymethyl methyl acrylate, and posterior chamber intraocular lens is made of, if it is rigid, it is made of PMMA, polymethyl methyl acrylate, and it is, if it's foldable, it is made of acrylic or silicon gel. Thus, there is nothing more to remember about the lens. Just remember that antechamber lens is S shape and posterior chamber lens is C shape. Then, little bit discuss about the syringing procedure. In syringic procedure, we use the about 3 ml of the irrigating fluid. At first, the anesthesia is used, mainly 2% xylogen, and then the punctum is dilated with the punctum dilator. And then the fluid syringing needles is inserted in 2 mm downward and 8 mm medially. Then the fluid is inserted. The contraindication of the syringing is, as we already know, it is acute decreciatis because it may cause the speed of injection into the sinusoid, in the adjacent sinusoid. Then let's talk about the lens expressor. Lens expression is also known as the lens hook. This is the picture of the lens hook, and this one is the instrument. And here it mainly contain of the flat metal handle with a round curve at the end. This one is a round curve with a flat metal handle. It is, what are the uses? The uses are, it is used to express the nucleus in extracapsular cataract surgery, mainly express the nucleus, and it can be also used as the muscle hook, and it is also used to extract the dislocated lens. One is express the nucleus, muscle hook, and dislocated lens. Next, the decimal retractor. As we know, the Dressman retractor is the saddle shape. It is folded in the one in an, it is folded in the one end. From D, we can remember the Dressman retractor used in the double eversion of the upper lid to examine the superfund. Mainly during the examination of the conjunctiva in the superfundus area, we use the Dressman retractor for the double eversion, and also it is, can be used for the removal of the corneal scleral sutures, and it can be also used to remove the corneal foreign body. Mainly foreign body removal. What are the advantage? Advantage, it allow the continuous adjustment of the lid and wide of the palpebral aperture, and disadvantage is it is not self-retaining, and so an assistant is required for it. Then next talk about the spring action needle holder or barracuda type needle holder. The picture shows, in the picture represent the barracuda type needle holder. Here the jaw is finely serrated to hold the needle firmly. Here we can see the serrated end. This represent the barcode shaped needle holder. We can remember from the serrated end. And what are the uses? It is used mainly, as the name given, it is needle holder. So it is used to pass the suture in the conjunctiva, cornea, sclera, and extraocular muscles. And then let's discuss about the castrovisual caliper. This is castrovisual caliper. This is the castrovisual caliper content of the, in the one side it is connected with the scale that is graduated in millimeter, and in the other side it is uh, it is and in the other side it contain of the screw. And here there is a, in the middle there is a screw that can fix the scaling after the reading has already after the reading is taken. So mainly castrovisual caliper used to measure the of the measurement of the squint ptosis, retinal detachment, and it is also used to measure the corneal diameter and horizontal diameter. Here, the metallic, this screw have to make the scale measure. This screw help to make the scale stables after the measurement. And then talk about the system. This picture is known as the system. Here, the we can, this is the system. Here we can remember there is a small blunt tip in the tip of the system, and it is also known as the capsulotomy, and it is mainly used for the capsulotomy or capsulorhexis during the extracapsular cataract surgery, and the size is mainly 26 to 30 gauge, which is the hypodermic needle. Then from picture we can also represent this is the system with small blunt tip, and here it is a plastic. And next, the hydrodissection cannula. This is the hydrodissection cannula, which is the metal with a curved end in the top side. And the hydrodissection cannula is used for two processes. One is hydrodissection and one is hydrodelineation. From the delineation N, we can remember the nucleus. Here, dissection, we can remember the C from capsule. So here, in the dissection, the cortex is removed from the capsule, and in delineation, the nucleus is removed from the cortex. We perform hydrodissection in the small incision cataract surgery, whereas the hydrodelineation is performed in phacoemulsification. Then let's discuss a few points about the anatomy. Here, the cannula is first procedure. Here, the cannula is first added to the syringe, which carry the irrigating fluid. And for the hydrodissection, a tip is introduced into the beneath of the anterior capsular margin. After capsulorhexis, it is tip is introduced in the anterior capsular margin, and then the fluid is injected, which causes the subcapsular separation, and then the hydrodissection is performed. And here we can compare the three picture. This one is the hydrodissection cannula with a curved margin, and this is the cystitum, and this one is the lacrimal cannula. And again, let's discuss about the lacrimal cannula. This one is the lacrimal cannula with the curve with the short uh, with a tone in the ending part of the pointed tip. And here the lacrimal canal is a long curved hypodermic is the hypodermic needle with a blunt tip, as we had already discussed, is mainly using preoperative procedure. For example, if in case of the syringing of the lacrimal passage, and in case of the as in antechamber cannula for putting the ear for tryptophan blue and pilocarpine and balanced salt solution in the antechamber during extra intraocular surgery. It is usually meant for syringing and for putting the something or some material in the antechamber. Then this one is the punctum dilator. As you can see, there is a pointed in one side, and we should hold it in a pen holding position. And this is the cylindrical metallic handle with a conical pointed tip in one side. And it is also known as the needle ship. What is it used? It is used to dilate the puncta and canaliculi during syringing, probing, dacrocystography, and dacrocystectomy. This is the picture of punctum dilator. And let's discuss about the scissor. There are three scissor. First one is the corneal scissor or section enlarging scissor. Here there is the fine. This is the corneal or section elastic scissor. It is the largest scissor among the all three scissors. It has the coping. It has the cutting blade which are kept apart by the spring action present in the scissor, and it is also called the universal corneal scissor because it can be used in the both eye. And what are the uses of the corneal scissor or section enlarging scissor? It is used to mainly, as name already implies, that it is used mainly to enlarge the corneal or corneoscleral incision in the cataract surgery. It is used to enlarge the corneal incision in the keratoplasty, and it is used for the cutting and ornament the conjunctiva, and it is also used to cut the scleral and trabecular tissue in trabeculotomy. Mainly, um, as already corneal scissor name already implied the corneal scissor, so it is used to enlarge the cornea in the cataract surgery, in the keratoplasty, and scleral and trabecular in the trabeculostomy, and again in the conjunctiva for the cutting and ornament the conjunctiva. And then the next one is the spring scissor. Spring scissor also known as the waistcoat scissor, and here the spring scissor, it is a straight or curved blade with here or sharp tip is present, and it also contains the spring action, as it is also a scissor. So from name, it is waist cut. We can remember that it is used for cutting and undermining the conjunctiva, and from the cut, we can also remember it is used for cutting the scissor. Then the last scissor is Banner scissor. The smallest one scissor is called the Banner scissor, and here it is small. It contains of the small cutting blade, as it is small in size and kept apart by its spring action. As scissor, it is also contains the spring action. This one is the pen scissor. This is the small scissor. And what are the uses of pen scissor? It is used to cutting the entry capsule of the lens in extracapsular cataract surgery, and it is used for the cutting the nylon scissor. It is used for pupillary for doing pupillary sphincterotomy, and it is used for performing the iridectomy, and it is used for cutting the pupillary margin. Mainly, scissor is used for cutting purposes. We can see in the pictures. This the small one is the pen scissor, and the middle shape one is the spring scissor or Wasco scissor, and the last one is the corneal scissor or sectional scissor, and which contain the serrated is known as the barcode shape needle holder. And now the lead clamp. Lead clamp, it is also known as the entropion clamp. First describe the part of the lead clamp. It consists of the this one is the D-shaped plate, and this upper one is the new shape rim. Here, D-shaped plate and U-shaped rim, and it also contains the screw to fix or to tight the lid clamp. But this technique, at first, this plate is put on the conjunctiva side of the eye, and the rim, this rim is put on the outside skin side, and the handle must be always put on the temporal side. Must be put on the temporal. What are the uses of the lid clamp? As the name already implies, the lid clamp, it is used for the lid surgery, such as the entropion and ectropion correction, and it is also used to protect the eyeball, support the lid tissue, and provide hemostasis during the surgical procedure. What are the advantages of lid clamp over the lid spatula? Here, it is, as we already know, it is a self-retaining instrument, so we does not need any assistant to hold the instrument. And what are the disadvantages? There is operative field loss, as the instrument block the operative field, and there if the pressure is more applied, then it may cause the pressure necrosis. This is the U-shape rim, D-shape plate. This one is the screw, and these are the two arm of the lid clamp. Next one is the Chalazion clamp. As the name already implies, it is used to fix the chalazion and achieve the hemostasis during the incision and curettage. For chalazion, we do the incision and curettage operation, and here the vertical incision are given because the meibomian gland are located vertically. What are the parts of the chalazion clamp? It contains of the two limb. The two limb are supported each other by the screw, and in the top of the one limb there is present a circular rim, and in the next arm, in the tip, it contains of the small circular discs, round discs, and here the technique is Here the disc should be on the skin side, and the ring should be in the conjunctiva side, just opposite to the lid clamp. And next, the Salagen scoop. Salagen scoop, in the incision and curettage procedure of the Salagen, it is used to scoop out the content of the Salagen during the incision and curettage. And here it consists of the small cup with the sharp margin, which is added to the narrow handle. And next one is the two-way irrigation and aspiration needle, aspiration cannula. It is used for, as the name implies, it is used for irrigation and aspiration of the lens matter during extracapsular carotid surgery, and it is also used for the aspiration of IPMI. Here, it content of the irrigation end, and this one is the tip is known as the cannula and aspiration end. Here, in the picture, we can also see this one is the aspiration end, and this one is the irrigation end, and this one is the needles. And this is also known as the oculoviscoelastic device. Here, it is connected with the anteriorly with the needle, and it is used mainly used to make the anterior chamber form, and the fluid used in the oculoviscolar acid device is 2% hydroxymethyl cellulose. 2% hydroxymethyl cellulose. And let's do a rapid revision.